Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about molar pregnancy or hydatidiform mole. Let's get started. Let's see about the definition of a molar pregnancy. It is a type of gestational trophoblastic disease, which means it arises from abnormal growth of the trophoblastic tissue that normally forms the placenta. In this condition, the pregnancy does not develop normally. Instead, the chorionic villi, which should support the growing fetus, become swollen and filled with fluid. These swollen villi cluster together and form structures that look like a bunch of grapes. This makes the pregnancy non-viable and requires medical management. Let's see about the two types of molar pregnancy, complete mole and partial mole. In a complete mole, there is no fetus and no amniotic sac at all. All the chorionic villi become swollen and turn into fluid-filled, grape-like vesicles. Because of this abnormal overgrowth, the beta-HCG levels become extremely high. Complete moles are entirely made of abnormal placental tissue with no fetal development. In a partial mole, some fetal tissue may be present, but it is usually abnormal and cannot survive. This type occurs due to a triploid karyotype, which means the cells contain 69 chromosomes instead of the normal 46. Only some of the villi are swollen, so the elevation in beta-HCG levels is moderate compared to a complete mole. Partial moles show a mixture of abnormal and normal-looking tissue. Let's see about the factors that increase the risk of developing a molar pregnancy. Maternal age plays an important role. Women younger than 20 or older than 35 have a higher chance. A previous history of molar pregnancy also increases the likelihood of it happening again. Nutritional deficiencies, especially low levels of carotene and folic acid, are known to contribute to this condition. Asian ethnicity is another recognized risk factor. Women who have a history of infertility or repeated miscarriages may also have a slightly increased risk. Understanding these factors helps in early identification and timely care. Let's see about the clinical features that help identify a molar pregnancy. One common sign is amenorrhea, meaning the woman misses her period just like in a normal pregnancy. Another key feature is painless vaginal bleeding, often described as having a prune juice color. The uterus may grow much larger than expected for the number of weeks of pregnancy because of the rapidly growing abnormal tissue. A classic symptom is the passage of small, grape-like vesicles through the vagina, which are the swollen chorionic villi. The beta-HCG levels are extremely high in molar pregnancy, and this can lead to severe nausea and vomiting, known as hyperemesis gravidarum. Early onset preeclampsia, especially before 20 weeks, is another important warning sign. When the uterus is examined, no fetal heart sounds are detected because there is no viable fetus. These features together help in early detection and management of molar pregnancy. Let's see about how a molar pregnancy is diagnosed. The most important tool is the transvaginal ultrasound. In a complete mole, the ultrasound shows a characteristic snowstorm appearance, or a cluster of grapes pattern, because of the swollen, fluid-filled villi. This helps distinguish it from a normal pregnancy. Another key finding is extremely high serum beta-HCG levels, much higher than what is expected for the gestational age. These high levels occur because the abnormal trophoblastic tissue produces excessive amounts of the hormone. In a complete mole, the fetus is completely absent, which further confirms the diagnosis. Together, these features help doctors quickly identify and manage molar pregnancy. Let's see about the immediate steps taken to manage a molar pregnancy. The preferred treatment is suction evacuation of the uterus. This procedure gently removes the abnormal tissue and helps empty the uterus completely. After the evacuation, an oxytocin infusion is given. Oxytocin helps the uterus contract, which reduces bleeding and lowers the risk of complications. For mothers who are Rh negative, anti-D prophylaxis is given. This prevents the development of antibodies that could affect future pregnancies. These immediate steps ensure the safe removal of the molar tissue and help protect the patient's health going forward. Let's see about the follow-up that is very important after managing a molar pregnancy. Once the uterus has been evacuated, the beta-HCG levels must be monitored closely. At first, the levels are checked weekly until they return to normal for 3 consecutive weeks. After that, the monitoring continues monthly for 6 months to ensure that there is no remaining trophoblastic tissue. During this time, it is important to avoid becoming pregnant for at least 6 to 12 months. This is because a new pregnancy would make it difficult to track the HCG levels and could hide early signs of complications. Reliable contraception is recommended, and oral contraceptive pills are often preferred because they are safe and effective. Following these steps helps prevent complications and ensures complete recovery after a molar pregnancy. Let's see about the complications that can occur in a molar pregnancy. One of the major risks is hemorrhage, because the abnormal tissue inside the uterus can cause heavy bleeding. Infection is another complication, especially if any tissue remains after evacuation. Trophoblastic embolization may also occur, where tiny pieces of trophoblastic tissue enter the bloodstream and travel to other organs. Although rare, it can cause serious problems if not managed quickly. A very important complication is persistent gestational trophoblastic neoplasia, or GTN. This means the abnormal trophoblastic tissue continues to grow even after the uterus has been emptied. GTN can appear in 2 forms: invasive mole, where the tissue grows into the muscle layer of the uterus, and choriocarcinoma, a fast-growing malignant tumor. Early detection through follow-up HCG monitoring helps prevent these complications and ensures proper treatment. Let's see about the important nursing responsibilities when caring for a patient with a molar pregnancy. First, monitoring vital signs and bleeding is essential to detect early signs of complications like hemorrhage or shock. The nurse should also maintain an IV line and prepare the patient for uterine evacuation, ensuring that all equipment and medications are ready. Emotional support is a very important part of care, because the patient is experiencing pregnancy loss, which can be emotionally overwhelming. Offering comfort, listening, and providing reassurance help the patient cope during this difficult time. The nurse should also monitor urine output, as it helps assess the patient's hydration status and kidney function, especially if bleeding or vomiting is present. Education is another key role. The patient should be informed about the importance of following up with beta-HCG tests to ensure complete recovery. She must avoid pregnancy for the recommended duration, usually 6 to 12 months, so that HCG levels can be monitored accurately. Finally, the nurse should teach the patient to report any severe bleeding, abdominal pain, or symptoms that may indicate complications. This helps ensure safety and early intervention if needed. That brings us to the end of today's session on Hydatidiform mole. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.